Hey guys, so today we're going to go ahead and talk about acute liver failure. Acute liver failure is the sudden and severe liver impairment in a healthy person. So this happens to someone that has no background in liver disease. This can be caused by viral hepatitis, hepatotoxic medications, chemicals, and metabolic disorders. The signs and symptoms are neurologic dysfunction such as confusion, tremors, and agitation. We can also see this, we might see an elevated PT and INR, and it's more than 1.5. So we're going to see bleeding and bruising in these patients. We're also going to see jaundice, right upper quadrant pain, nausea, vomiting, and fatigue. There are two types to liver failure and acute liver failure. It's hyperacute and subacute. For hyperacute, we're going to see an onset within hours, with jaundice to be seen in 0 to 7 days. So this is very fast. For subacute, we're going to see an onset of days to weeks, and the jaundice will be seen in about 28 to 72 days. So this will be progressive. There are some diagnostics such as a liver biopsy and also identification of the cause. Some of the things that we can do are also an ultrasound to see if we have any hepatomegaly, and also an X-ray or a CT. We also want to make sure that the PT and INR is not elevated before we do the liver biopsy because they're at risk of bleeding. So for treatment, we have all of these treatments. First, we're going to do a liver transplant. This is very, very urgent because this person is going into acute liver failure. So for the liver transplant, we might do a partial or a whole transplant. We're also going to do plasmapheresis, and this is to treat the coagulopathy and decrease the ammonia levels in the system. We're also going to give the antidote for acetaminophen. Remember, we said hepatotoxic medications, so that would be N-acetylcysteine. And then for mushroom poisoning, which can also count as a hepatotoxic chemical, the antidote for that is penicillin.